Hi everyone, my name is Robert Schulz, and on January 25th, I look forward to presenting with colleagues David Danino and Dr. Brian Van Brunt through the DPREP series, Pathways to Enhancing Your Team Approach, where we will be talking about how to address the suicidal individual. We'll have a number of different topics we'll cover, but we'll also really provide some space for your questions and some case discussion or things that you're seeing on your campuses. One of the areas we will talk a little more in depth about that I'll offer a little bit of a preview on today are some of the myths about suicide and talking about suicide with people. First is just the myth of that if we talk about suicide with the suicidal individual and we ask them about it, that they're more likely to go on and act that out. And the fact is that nothing could be further from the truth. Oftentimes, people feel a lot of relief if they're in that place of having serious suicidal ideation or thinking about hurting themselves. So we want to dispel that myth, that we want to talk about it, we want to get it out in the open. The second myth is this idea that people who are making suicidal comments are just doing it for attention. And there could be nothing further from the truth. At a minimum, it is a sign that a person is in serious distress and needs further help. In worst case scenarios, it is a true cry for help that they do not feel safe with themselves. And we want to take any utterance of suicidal ideation serious. And the final myth is just the myth that there's nothing we can do to prevent suicide. And that one is also false. There's a lot we can do. That the suicidal behavior and the ideation and behavior are often the result of untreated or undertreated psychiatric condition or substance abuse disorders. And that if we can really get the person the help they need, we can go a long way to prevent a person from acting on those suicidal thoughts. We look forward to talking more with you in a couple of weeks, and thank you so much.